So have you just had a robotic radical prostatectomy to manage your prostate cancer, or are you staring down the barrel and awaiting surgery, and you've still got some unanswered questions with regards? How are you going to feel like after surgery? Are you ever going to feel the same? And what about those aspects that many men don't like to address, such as how are you going to pee? Are you going to be incontinent longer term? And that biggest question for many men, not all, but for many men really is, what's sex going to be like following surgery? If you want answers to these questions, please stick around and I'll address them for you. Hi, if you're new to the channel, my name is Dr. Charles Chabert. I'm a urologist and director of the prostate clinic located on the Gold Coast in Australia. As always, if you get benefit from the video, please give it a thumbs up, subscribe to the channel, and leave comments or questions or share your journey in the comments section down below. Okay, let's get into it. One of the most common questions I get is, once you've removed my prostate, surely that is my prostate cancer gone forever? And I try and highlight to people that the way that we can predict the long-term probability of cure really is looking at the profile of the final lab test when we send someone's prostate off for assessment after they have had a radical prostatectomy. One of the challenges that many men find trying to get their head around really is the concept of, before they have treatment, they may have a PSMA PET scan. And the purpose that we tell men of that scan is to make sure that there's no spread of cancer before they have treatment. So for them to then be told after surgery, they then need to continue on with PSA testing to make sure there's no evidence of recurrence, for many men is a bit of cognitive dissonance. Meaning that, why do they need to have the PSA test done if the PET scan was clear before surgery and now they've had their prostate removed? How could it possibly recur? Well, to understand that, we really need to get to the heart of prostate cancer and the specifics that we see with regards to the probability of recurrence. So when we send someone's prostate off to the lab, the final information that we get really relates to the Gleason score. You may remember that ranges from 6 at its least aggressive to 10 at its most aggressive. So we get the grade when we send the prostate off, and we know from that, really, is someone's cancer more or less aggressive. Obviously, the more aggressive cancers are more likely to recur when compared to the lower aggressive cancers on that scale. The other thing that we find out is the size of the tumor, and we've got, in many ways, an arbitrary cutoff of around 3 cubic centimeters. If your cancer is less than 3 cc's in size, we define it as a lower volume cancer, and if it's above 3 cc's, we say it's a larger volume cancer. We digress from the video from a second, but if you'd like to be part of our growing community, please follow the link in the comment section down below and sign up to our free newsletter that comes out on a weekly basis, keeping you up to date with all aspects related to prostate health and various treatments that are available for men. Now back to the video. The additional information we get is the cancer contained? So is it all confined within the prostate, or has the cancer breached through the shell? Obviously, cancers which are locally advanced, i.e. have extended through the shell, or perhaps even extended to the seminal vesicles, which are the structures that are attached onto the back of the prostate. They are, in many ways, a reservoir for ejaculatory fluid, and they are removed together with the prostate at the time of a radical prostatectomy. So invasion into the seminal vesicles or invasion through the shell of the prostate, again, both of these characteristics are a sign of more aggressive underlying pathology. The other thing that we find out is whether or not there is cancer that has grown right up to the margin, right up to the edge of resection. All of these features we look at following a prostatectomy, and that tells us how likely is someone to recur. So the greater the number of aggressive or adverse characteristics, the greater the risk that a cancer cell can have flicked off, and it can lay dormant for a period of time. And when it does lay dormant, ultimately it can multiply, and then we see the PSA go up. So I say to all men that the reason that we do the PSA test really after surgery is to make sure it's zero. If it's not zero, it tells us that we've got a cancer cell or cells somewhere that are beginning to become active, and that's why we see the PSA test increase. Many men will say, well, hang on a minute, Charles, the PSMA PET scan was negative before I had surgery. So how can this be? And I say to them that even though the PSMA PET scan is without doubt the best tool that we currently have for staging prostate cancer, which basically is a term that we in the medical community use to try and work out the extent of someone's disease, i.e., is it in the prostate or has it gone to lymph nodes or further afield to bones? So there needs to be a certain burden of disease before we can detect it, despite the advances in our technology for staging prostate cancer. Question number 2. How long until I feel normal again after a man has his prostate removed? Well, I say to all men that have a radical prostatectomy, a robotic radical prostatectomy at the prostate clinic, that the majority of men are in hospital overnight. Sometimes men are in for 2 nights. So we have an average length of stay between 1 and 2 nights. Men are discharged with their catheter in place, and they keep their catheter for a week. You may recall that we do a cystogram or a dye test at a week, and the purpose of that really is to make sure that the join between the bladder and the outlet pipe has sealed sufficiently for us to be able to remove the catheter. Immediately after surgery, I try and encourage men to get up and to mobilize, to start walking. And the more diligent they are with walking in that first week following surgery, the quicker really they start to return to their normal sense of being. As a crude rule of thumb, I encourage men to walk a minimum of half a K the day after their operation, and then a minimum of 1 kilometer from day 2 onwards. Now, what happens when you walk is not only do you feel better, you increase your heart rate, your blood pressure, you reduce the probability of developing clots in your legs, which can, if that were to develop, end up with clots in the lungs themselves. But it also massages the bowel and the tummy and allows the bowel function to return to normal. The 2 things that I consistently hear from men having done this surgery thousands of times over the last 20 years really is that no man likes the catheter and no man likes the sluggish bowel function that can accommodate surgery. So as a crude rule of thumb, I say to men, drink plenty of water, make sure the urine in your catheter bag looks nice and clear. That's your metric for being appropriately hydrated, and walk. And as you walk, bowel function returns, you feel better, you see the sunlight. Obviously, that will depend on which part of the world you're watching this video in, but certainly if you're on the east coast of Australia, you see some sunlight and you start to feel better. Moving forward, I encourage all men, stay away from your normal activities such as golf or operating heavy machinery or riding a mower, or certainly in Australia, surfing or swimming in the ocean or cycling. Avoid the gym. Really, although all of those things are great in the long term, it does take time to heal. And one of the biggest challenges that I see for many men is that, following a robotic approach, there are little scars on the tummy, and I make 6 little incisions in the tummy. And there's really a bit of a disconnect between the amount of work that we've actually done internally and what they see on the surface of their body. And so I try and encourage men, just slow it down a little bit after surgery. Walking is great, but try and avoid excessive exertion for around 6 to 7 weeks after the operation. And I counsel all men, if you do too much too soon, the concerns that we have are, number 1, there can be some disruption to the anastomosis. The anastomosis is the join that we make between the bladder and the outlet pipe. We want that to heal. So let's not do anything to jeopardize that. The other cautionary piece of advice I give men is, if they do too much too soon, we do run the risk of developing a hernia or a weakness whereby the tummy contents can push through one of the holes that's created to get the instruments in to facilitate surgery. So give it time to heal. Okay, the next question. What should I eat? Or are there any foods or fluids that I should avoid during my recovery period? Like I've alluded to, I encourage everyone stay really hydrated. Use the color of your urine as a metric to determine if you're hydrated enough. If it is dark, if you do see a little bit of blood in your urine, have a glass of water. Try and flush things through. In that first week when men are recovering, as I alluded to as well, the bowel function can be a little bit sluggish. And so smaller, lighter meals are going to be a bit easier for men really until they have their first bowel motion and things begin to settle down. It's not uncommon for men to feel a little bit bloated in the tum, and they can have some wind discomfort in their tummy after surgery. Lighter meals means that we don't make that worse. Plenty of fluid maintains hydration, and the walking allows your bowel function to settle. When the catheter comes out, it's important to be aware that we move from a situation of trying to make sure we're really well hydrated to a situation where we don't unnecessarily upset bladder function. And I say to all men that the things that can really flare up bladder dysfunction are anything that has a diuretic effect. So a diuretic effect basically is anything that will promote a man making lots of urine in a short period of time. So number one, guzzling lots of fluid. So if you're drinking 2 or 3 liters of fluid a day, you'll make your urinary function worse. Remember, most men go through a period of urinary incontinence, and the more urine you make in a shorter period of time, the greater the risks to your continent recovery are. You're not going to break anything, but it just means that you're probably going to be wetter for longer. So be cognizant of guzzling lots of fluid. The other thing to be mindful of is caffeine. So the common sites of caffeine are either coffee, tea, or if people like having energy drinks. Now, caffeine is a very powerful diuretic. So if you have a mug of coffee, which could be 300 or 400 mils, sorry for the American audience, I cannot translate that through into fluid ounces for you, but it's a standard mug of coffee that I'm sure we all have globally. So that is a fluid load and a diuretic effect. So you will fill your bladder in a shorter period of time. And again, that can exacerbate potential incontinence. So be mindful of tea and coffee. And if you're someone who likes energy drinks, be mindful of those because they tend to contain quite a lot of caffeine in them. The other thing is alcohol consumption. So alcohol consumption when your bladder is recovering, particularly beer, there are very few men on the planet who do drink beer that can only have one. If you are of that ilk, great. But the majority of men, when they have a beer, it tends to be more than just one. And so be mindful that, again, you are combining fluid load and also diuretic effect, and the potential for upsetting urinary continence is greater. So if you wanted to set your day up for being the most problematic, start with 2 cups of coffee in the morning, strong cups of coffee, have 2 or 3 liters of water through the day, get on the beer in the afternoon. And that really is going to be the worst scenario for you in terms of making your incontinence worse. So be mindful of those aspects. What about the catheter? I've made mention that no man really likes having a catheter in place. And certainly in my practice, we've looked at adjusting the period of catheterization over the last couple of decades. To give you an idea of how this has evolved for me and my practice, historically, we used to leave the catheter in for a couple of weeks. And when I say historically, this is going back almost 20 years. We'd leave the catheter in for 2 weeks. No one would have the dye test, which is called a cystogram, and the catheter would just be removed. And the probability that things have healed for just about every man at 2 weeks is exceedingly high. And that's why that pathway was adopted. Over the years, we've tried to reduce the duration of time that a man has a catheter for obvious reasons. The challenge is if you take a catheter out too soon, and by that I mean day 3 or day 4, when you're dealing with large proportions of the population who have this procedure, there's a greater risk that there is still a lot of swelling at the joint between your bladder and the urethra or the outlet pipe, and men don't pee. And so I have found in my experience that the sweet spot really is around 7 days. We do a dye test. In about 90% of people, in 98% of people, it's sealed at that time and the catheter comes out. So yes, before men leave hospital, they're given advice with regards how to look after the catheter, how to manage the leg bag, how to pipe the night bag into the leg bag. And that's a really important factor because we're trying to reduce the number of times that there are open communications. We're trying to reduce, in essence, the risk of infection. Now, on that point, when a catheter's been in place for more than 24 hours, the probability of colonization, i.e. natural bugs that we all have everywhere in our bodies, the probability that those bugs gain access to the catheter is really high. In my practice, when we remove the catheter, we send a urine test off, and the probability of finding something on the urine test is quite high. But for the majority of people, the process of removing the catheter itself, giving a single oral antibiotic at the time is sufficient, and men usually do not require additional antibiotic therapy beyond that point. Many men want to know how they're going to feel emotionally after surgery. It's a big deal to go through this process, and whilst the surgery itself is minimally invasive and the physical assault on a man's body has declined significantly over the last 2 or 3 decades during the time that we've been performing radical prostatectomy, there without doubt is an emotional toll for men to bear during this time. Many men feel a sense of loss. Many men can feel a little bit depressed following this process. And I try and encourage men really as best they can within the limitations of the activities that men are allowed to do, certainly in that first 7 weeks or so, but try to maintain normal relationships with your friends, with your family, with your partner. Try and get out, try and see sunlight, and allow time to really heal. But if you have had this surgery and you're feeling a little bit flat, I think it's important to know that you're not alone during that process, and certainly try and communicate that either with friends or if you're part of a support group where you can share your experience with other men who may have gone through this. I think you'll find if you do open up that there are many men that struggle following A, cancer diagnosis, and B, surgery to remove their prostate. Okay, the big ticket items for many men, particularly younger men undergoing this surgery. Number one is, what's going to happen to my libido? Well, libido or sex drive is multifactorial, and having a high or normal and healthy libido is a byproduct in many ways of a happy, healthy life with a good relationship and looking after yourself across the board. Adequate sleep, eating well, exercising regularly, moderating alcohol consumption, all of those things play a role in terms of a healthy libido. Now, there's no doubt that following surgery, for a proportion of men, libido can take a hit, and it can take a hit from a psychological point of view, but also when we look at a hierarchy of needs that many men have, number one is always cancer cure. Number two is recovering continence ASAP. And the third aspect for the majority of men is sexual function recovery. And bearing in mind that priority for many guys, libido does take a backward step whilst men are prioritizing their recovery physically from the surgery and also from a continent point of view. So if you do notice that you're feeling that your interest in having sex or being intimate with your partner is less than it has been previously, be open about that and be understanding that that is, for many men, a process that they go through, and just to be patient and not hard on yourself during that time. Okay, so what happens to sexual function? Well, sexual function is two things. Sexual function is erections and also ejaculation. If I look at ejaculation first, so when a man normally ejaculates and emits fluid, that fluid, almost all of that fluid comes from prostate and also seminal vesicles. A tiny amount of ejaculatory fluid actually comes from testicular sperm production. Now, following surgery, obviously we divide the pipes that connect the testis through to the prostate, and the prostate is removed. So any ejaculation after surgery is completely dry. Now, many men say to me, it feels the same, but there's no mess. Some men say it feels a bit weird and it takes a bit of getting used to. Other men, and this is a smaller proportion of men, but a smaller proportion do say, you know what, Charles, it feels a bit more sensitive, and arguably it's a bit better than it was. And part of me wonders if that experience that many men have is that it is related to a reduction in stress, knowing that they've treated their cancer and they're moving on with the next stage of their life. But it must be said that for men to experience a more intense ejaculation process or orgasm process, that is certainly the minority rather than the rule. Okay, erections following surgery. Now, your urologist may have mentioned this to you, but erections are dependent on a variety of different factors. From a surgical point of view, it is critical that we spare nerves, spare the neurovascular bundles, which basically are structures of tissue that contain microscopic nerve fibers. Now, these nerves are plastered on the backside of the prostate and they innervate or supply the penile tissue. You need to have intact, healthy, functioning nerves to be able to have an erection. Now, many men are preoccupied and very worried for obvious reasons, but are very worried about the probability of having nerve-sparing surgery. But they may come to the table, as it were, with poor erections before we start. So, for example, if you are a man in his 70s, if you carry excess weight, if you have type 2 diabetes, if you have high blood pressure, so if you have aspects related to metabolic syndrome, the probability is that your erections aren't nearly as good as they used to be 10, 20, 30 years ago. And so the starting point at entry when men come to surgery is critical in determining the probability of recovery. If you're a younger man and a healthy man who carries no excess weight and has good sugar control, no elevated blood pressure, no cholesterol, and your disease profile allows us to spare both those nerves, there's actually a very high probability that that man recovers erectile function. Now, every man is obviously unique and every man has his own risk factors for erectile dysfunction preceding and following surgery. And that's important to be aware of. I often hear, anecdotes from patients that their mate down the road had an operation and he recovered in a week. Well, if you dial down to the nuance of that man, he may have had for example, very small prostate with an anteriorly placed cancer, i.e. a cancer that's away from where those neurovascular bundles are. He may be very fit and healthy and a lean man with none of the risk factors for metabolic syndrome. And yes, in that situation, men tend to recover more quickly and more completely. So it's important to be aware of your potential risk profile going into surgery and certainly have, therefore, some insight with regards to the probability of recovery for you. I hope you found this video helpful. Please, if you've got comments, questions, or you'd like to share your journey, leave it in the comment section down below. Until the next time, take care of your prostate. Have a look at this video for more information and perhaps this one too.